Hello, this is Dr. Hizon, here to talk about the documentation and medical informatics for urinary tract infections, commonly known as a UTI. As a general disclaimer, please refer to your particular doctor, as this is a general course not intended to be medical treatment, and your particular situation may vary. Symptoms of a UTI are burning and sensation during urination. There might be frequency and intense urgency to urinate, where they have to urinate very quickly. They could have dark, cloudy, bloody, or strange smelling urine, and they may have pain or burning in the pubic area or even in the flank. It could be chills or fever. There could be signs of dehydration, lower back pain, costovertebral angle tenderness, which is flank pain, and on the urinalysis, they may have some abnormalities. We usually will do a history and physical. May do some lab tests, especially your urinalysis, especially a first morning void urinalysis. And then we may want to do a CT scan or a computer tomography scan to see for kidney stones, and or an ultrasound of the kidneys to look for hydronephrosis or water on the kidneys. Treatment typically depends on what the diagnosis is, but it's per the urine culture. They don't necessarily always get a urine culture, but that will direct us as to what antibiotic to use. Usually it's lifestyle modifications or increased hydration with water. Typical antibiotics we might use for UTI is Bactrim, Septra. You can use microdantin or macrobid. And usually it's for a short course, 3 to 5 days. And then you do monitoring as needed. In terms of lifestyle, it's encouraged to drink plenty of water, but to urinate pretty frequently. If it's really bad, you can use a heating pad, or sometimes you have to discuss exactly how to for them to wipe after urination, especially for the women. Medication is prescribed and follow up as needed. The documentation for a patient with UTI might go something like this, with painful urination or foul smelling urine for, say, 7 or 14 days. And then you go through and step through the template as to how old they are, male or female, if they have any previous other complications, and then what's their pain level at rest, what's their pain level with activities. And then these are the typical kinds of other symptoms they might ask is frequent urination, cloudy, foul-smelling urine, blood in the urine, flank pain. Is the timing constant, intermittent? Is the quality sharp, dull, or achy? What makes it worse? So what provocations? What makes it better? Do they have other symptoms, even vaginal discharge? Do they have previous history of UTI? And how have they been treated so far? Have they had any previous medications? Because if they've used a lot, they might be resistant. Have they had physical exams? Have they ever seen a urologist? And then past medical, family, social history. Tobacco use increases their risk. Exercise, nutrition, sleep program. How are they generally doing? Have they got lost or gained any weight since the last visit? As well as their review of systems. And an objective template might look something like this, where you do a general overview. Are they in mild, moderate, severe distress? And then cardiopulmonary, abdominal exam, but especially looking for suprapubic tenderness. Back, do they have any costovertebral angle tenderness, CVA tenderness? So you might see that prescribed or abbreviated as CVT or CVAT. And then again, with the abdominal exam, you're looking for suprapubic tenderness, and pelvic exam if indicated. On the medical decision making, is it simple or complicated? Does it require straightforward or complex decision making? And this is a time when the provider and doctor can give rationale and reasons for why they're considering a UTI. These are some of the codes, ICD-10 codes that can be used. If you're just screening for UTI, that would be a Z code. So Z is for screening, Z87.440, or urinary tract infection site not specified is N39.0. Plan and treatment will do patient education, lifestyle modification, medications, and a physician evaluation. So if there is any laterality to their symptoms, get the correct patient side. Again, get the correct patient side. Really focus on getting that correct. Be sure to document all symptoms, previous history or family history, and please don't hesitate to ask your doctor if you have questions about the UTI. And also, if in primary care, make sure you also ask about quality measures. When's their previous colonoscopy, mammogram, pap smear, those sorts of things that will get good quality scores. So takeaway points: not every UTI presents the same way, even in the same patient. Lifestyle modification can assist in preventing the urinary tract infections. Usually there's previous UTIs, and in women it's different than in the fellas, and so be careful that you are very good about documenting depending on what the physician says. Learn all the various questions that you can, and also learn about the urine dipstick testing to assist in the diagnosis. Again, thank you for all you do. While doctors save lives, medical informatics specialists save doctors. Thank you.